Workers' pains deepen as inflation eats up 70,000 naira minimum wage in Nigeria. Low staff hits NHIS. Things you need to know about workers' mental health issues as water crisis increasing Africa's health challenge. Thanks again for joining us on your program of choice, The Tripartite. I am Abulu Osemahu. Now, the tripartite, which focuses on the worker, the employer, and government policies, is today's Africa's #1 labor program on TV. You can be part of this program by partnering with us, sponsoring a segment, or placing an advert.
The Tripartite. It's new, it's fresh, it's informative, it's educational, and it is authentic. The Tripartite holds onto the workers, the employers, the government, and the international development partners on a round table to critically dissect issues concerning employment, productivity, welfare, safety, and health. A people united can never be defeated. Join us on the Tripartite, the worker, employer, and government roundtable.
Let's take a look at the global news shaping the world of work. Later on, we'll bring you Let's Talk, our special segment, and your feedback. It was the International Workers' Day on May 1, and Nigerian workers joined their fellow comrades worldwide to celebrate. The event, jointly organized by the Nigeria Labour Congress, that is the NLC, and the Trade Union Congress, TUC, brought workers together at the Eagle Square in Abuja for a march past and to express their concerns over employers and government's actions towards employees' welfare. A major worry among the Nigerian workers is the 23.18% inflation rate, which they say has eroded the 70,000 naira minimum wage. In February 2025, Nigeria's annual inflation rate decreased to 23.18%, its lowest level since June 2023. Food inflation also eased to 23.51%, the lowest since September 2022. However, the headline inflation rate surged to 24.23% in March and April 2025. A new poll reveals a deepening staffing crisis within the National Health Service, that is the NHS, jeopardizing patient safety, particularly in maternity and rehabilitation wards. A unison survey of nurses, healthcare assistants, and midwives found that a staggering 69% of shifts were understaffed, a marked increase from 63% just 2 years ago.
Good morning. Time to take the patient's temperature and blood pressure, and time to talk.
I'm going to just check your blood pressure observation.
It seems so simple, yet when there aren't enough nursing staff, something has to give.
We have some staffing challenges in ED, also in ICU today. We've come in this
Each morning, senior staff at the Royal Berkshire work out how many nurses they have on shift and where to put them.
We've got 3 empty beds, but we've got 6 to come in.
They regularly have the number of nurses they planned for. The same simply cannot be said for other hospitals.
There is a shortage of nurses in England, and that is a real challenge to the country. Nursing is a safety critical profession, and if we don't have the right staffing levels and skill mix, then that essentially puts patients at risk.
After the mid-staff scandal found a historic understaffing of nurses was partly responsible for horrific failures in care, the government ordered hospitals to publish their nurse staffing levels. Somewhere along the way, that stopped. So we have spent months obtaining the figures ourselves, and today we can reveal the shocking extent of England's missing nurses.
Exclusive data obtained by Channel 4 News reveals that over the past 2 years, hundreds of wards and hospitals across England have suffered from serious nursing shortages. And experts have told us that this increases the risk of patients coming to harm or even dying.
Among the worst affected overall are Queen Elizabeth Hospital in Birmingham, Liverpool Women's, and even Great Ormond Street, the most famous children's hospital in Europe. On average, their wards missed 20% of the nurses they planned for. And neonatal wards were particularly affected at Broomfield Hospital in Essex and Alderhay Children's Hospital in Liverpool, which were missing 30% of their planned nurses. These hospitals told us they prioritise patient safety and they are confident their staffing levels are safe. They say the data doesn't capture the ways they ensure patient safety, such as regular assessments of patient sickness and bed occupancy and reassigning other staff. Some said their nursing rates would appear lower when wards were not fully occupied with patients and nursing numbers were reduced as a result.
We know, in very simple terms, that if nurse staffing falls below what's planned, then it is likely that patients are being put at risk, and that means all sorts of things, including increased risk of death.
Is this hyperbolic?
There is a substantial research evidence that has looked internationally, also in the UK, following patients through hospital, looking at the staffing they experience every day, and it shows that there is an appreciably measurable increase in risk of death. So no, that's not hyperbolic.
Dave Carr is a critical care nurse and a Unite Union representative.
Is care being compromised?
How can it not be when you have less staff, when you have less experienced staff, and if you've got increasingly tired nurses and your senior nurses that hopefully should be supervising your junior nurses, more tied up trying to find beds, trying to find nurses to plug gaps later on down the line, you can see what might be brewing.
Other nurses we spoke to didn't want to reveal their identities, but shared their experience of short staffing on the wards.
I've seen someone left in a soiled pad for over 6 hours. It's horrible because people can smell it, but you need someone's help to change it, and there aren't enough nurses. That could be your cousin or your grandma. You'd hate to see your loved one in that position.
Let's go to the South Asian country of Nepal. From facing daily risk to embarrassing safer practices, tea garden workers in Nepal are redefining how quality tea is grown with safety, health and dignity.
I am a member of the Tinjoti Farmers Cooperative. I have been working in the tea garden for the past 7 to 8 years. In the past, when we picked tea leaves, our main focus was on how much we could harvest and who would pay us. We didn't pay much attention to safety. We used to walk without wearing boots, which exposed us to leeches in the garden that would bite us. We also carried baskets on our heads, which caused strain and pain in our heads and backs. The paths were unclear, and we frequently faced risks like slipping, falling, and getting pricked by the tea bushes. I participated in the occupational safety and health training organized by the Central Tea Cooperative Federation with the support of the ILO. Through this training, I learned how to make improvements in our work while keeping costs low. We were taught the importance of wearing boots and aprons, carrying baskets properly to avoid strain on our heads, tapping fingers to prevent injuries, and clearing paths to reduce the risk of accident. By improving our occupational safety and health practices, we have experienced significant health benefits, and we continue to follow these measures to this day.
A new report from the International Labour Organization, that is the ILO, explores how artificial intelligence, AI, digitalization, robotics, and automation are shaping occupational safety and health in workplaces worldwide. However, I must tell you, the report stresses the need for proactive policies to ensure these technologies are implemented safely and equitably.
The effects of artificial intelligence aren't set in stone. It's what we decide to make of it. We need informed decisions, policies, and innovations to shape AI's use in the world of work. We need to build on opportunities like AI tools for improving workplace safety while eliminating risks. Algorithms built on data that may not treat all workers fairly, or AI models that make decisions without transparency. The AI revolution could change 1 in 4 jobs. Some will disappear, like certain data entry roles. Others will change and will require new skills and adaptability. Managing these changes is a collective responsibility. Social dialogue holds the key. Through dialogue, we can shape where AI goes. We can transform barriers into bridges. The International Labour Organization stands for decent work. We aim to help understand and respond to AI's integration into the world of work. Our Observatory on AI and Work in the Digital Economy leads the way as a source of expert knowledge in this digital age. Together, we can ensure that AI is at the service of humanity and not the other way around. That AI boosts productivity while respecting rights and ensuring fairness. The future of work with AI isn't predetermined. It's ours to shape. Let's create a human-centered AI future that works for all.
Now, there are some things you need to know about mental health in the workplace. Unquestionably, mental health has been a big workplace topic over the past decade. But rather than diminishing, the focus on employees' emotional well-being seems to be growing with each passing year. This increased emphasis is understandably given a number of statistics that are hard for workplace leaders to ignore. For instance, a 2024 survey from LIMRA, a Windsor Corn-based insurance and financial firm, found that 75% of U.S. workers say they have experienced at least one mental challenge, such as anxiety, depression, grief, or thoughts of suicide, either sometimes or often in the past year, with 37% dealing with mental health issues often. Now, in honor of Mental Health Awareness Month in May, here are some overview of what you need to know about the topic. For healthcare workers and patients across the world, water insecurity is already a crisis. Africa's healthcare infrastructure has long been fragile. Now climate change is pushing it to the edge. Climate change affects us all, but for health and care workers toiling energy-stressed countries like Zimbabwe, it is an immediate and relentless crisis. While many can adapt, finding ways to cool their homes, store water, or endure blackouts, healthcare workers don't have that luxury. Their job is to keep people alive, no matter how dire the conditions, yet with hospitals running dry and plunging into darkness. Their ability to provide even the most basic care is crumbling. Just imagine delivering a baby by the glow of a phone flashlight. Picture trying to stop the spread of infections in a hospital with no running water. These are not hypotheticals. This is the lived reality for thousands of nurses, midwives, and hospital staff across the continent of Africa. Climate change is fueling power outages, water shortages, and disease outbreaks, turning an already strained healthcare system into a battlefield of some sort. And the people fighting on the front lines, yet they are exhausted, underpaid, and ignored.
The tripartite, it's new, it's fresh, it's informative, it's educational, and it is authentic. The tripartite holds onto the workers, the employers, the government, and the international development partners on a round table to critically dissect issues concerning employment, productivity, welfare, safety, and health. A people united can never be defeated. Join us on the tripartite, the worker, employer, and government roundtable.
We told you earlier that workers' pain deepens in Nigeria as inflation erodes the gains of the 70,000 naira national minimum wage. May 1 was International Workers' Day, and Nigerian workers celebrated, but with anger and hunger in their bellies. It's a carnival of some sort at the Eagle Square, venue of the 2025 International Workers' Day. And workers are celebrating, singing, dancing, and wishing themselves well. But behind the dancing and celebration, hunger and anger have been the workers.
Today, an average Nigerian worker cannot even afford 2 square meals in a day. Today, an average Nigerian worker cannot secure a good accommodation. Today, an average Nigerian worker cannot even get a good medical care because of what? The poor in the wage that we receive.
May Day is here, but we have to go beyond everyday celebration. I love the situation where implementation is key. After this year, next year is coming. What did we achieve in 2025?
It's a mixed feeling because of the socio-economic challenges, the hardship, and the erosion of the 7,000 minimum wage.
They say no to hunger, no to poverty, no to hardship, no to corruption, no to police brutality, no to bad governance, no to starvation. To ban immediate withdrawal of the over tax rate, to not progressive taxation, to not create excess of taxation. We demand support for the informal economy, the true backbone of the Nigerian economy.
President Bola Tinubu, represented by Labour and Employment Minister Mohammed Dingyade, led other government functionaries to appeal for more patience regarding the implementation of economic reforms. Veteran Labour leaders react to the situation of today's working people amidst technological advances.
Today, AI, is taking over. So the generational, gap, is so evident. There is much more confidence now in terms of working class ability, in terms of their contribution, to the growth of the economy. But there are still challenges in the areas of the benefit of this growth.
You remember that in the past, their best example used to be Argentina, until the economy of Argentina crumbled. So we are in the same situation. Therefore, going forward, workers must continue to organize, workers must continue to unite, and workers must continue to advocate for better policy options.
Beyond the demand for fair treatment, Nigerian workers are also making a strong demand to end open defecation. For months, workers in Nigeria at both the federal and state levels were on the streets agitating for a new national minimum wage. Their agitation came with a compelling context. Cost of living and inflation had made 30,000 naira minimum wage utterly useless. President Bola Tinubu's economic policies, particularly the removal of fuel subsidies, had sent prices off the roof. The demand was not for a minimum wage, but a living wage of at least 500,000 naira. But after much negotiations and stalemates, in July 2024, President Bola Tinubu signed into law 70,000 naira as national minimum wage. It was an anticlimax of sorts, and 9 months down the line, 20+ states are yet to implement the law. These states include Cross River, Yobe, Gombe, Zamfara, Ebonyi, Kaduna, Borno, Imo, the Federal Capital Territory Abuja, and 11 others.
Because there is no way, even the security vote of a governor is how much? Now you're not saying that they cannot pay ordinary minimum wage of what? 70,000 naira. The money they're using flying abroad every day in wasting, carrying all close-up convoy and spending, wasting Nigerian money.
Still yet to be there, as a lot of our workers are yet to receive the minimum wage of 70,000, which I hope from today it will be a certain point whereby all workers at the end of this month will receive and benefit the 70,000 minimum wage. Although circumstances has even defeated that.
Others, though, like Lagos, Rivers, Edo, Bayelsa, Akwa Ibom, commenced implementation, paying between 70,000 naira and 85,000 naira. But they have been criticized by organized labor of inappropriate application of the consequential adjustment mechanism.
That person that is paying the 4 officer, 70,000, is violating our rule. Because that's not the least paid. The least paid is level 1, step 1. But you now pay level 4. What you are supposed to pay level 1, step 1. So that is why I say they are implementing it in breaches.
While the complying states pay their workers, local government workers and primary school teachers continue to agitate that they have been left out, the FCT being a typical example.
The issue of minimum wage, the lack of implementation of minimum wage to my workers at the area, 6 area council in the FCT. There is upward review of 25% point salary that was done years back, and the area council chairman have refused to also implement it.
The case in the private sector is the least talked about. Many still earn less than 30,000 naira in both the formal and informal sectors. Most of the businesses are themselves burdened by the weight of other factors of production, and forcing them to pay the minimum wage will push them into bankruptcy. Analysts have blamed these on the entire economic system and policies of the Tinubu administration. Policies to cushion the economic effect, such as the CNG initiative and affordable public transportation systems, have yet to be fully implemented in many states.
Continue to talk to the government to make them understand, to work on how they can stabilize the naira value. If not, this economic hardship will continue to pass, irrespective of whatever they do.
As a worker in Nigeria, you do the work which 10 persons can do in other countries, in other parts of the world, and you receive lesser amount. So the government has a lot to do to make workers.
Workers have no other option than to survive on loans and debt as household incomes dry up. On the flip side, public sector waste has continued as cost of governance remains high, not just at the federal level, but the states. The call for a tightening of belts seems only the masses.
That's what we are excited and committed to ensure that as the Nigerian workers work, they have the confidence that the social safety net that is the backbone of their work, that is the backbone of their endurance and ability to discharge their responsibility is sacrosanct, and that's what we stand for.
The 2025 Workers' Day presents yet another opportunity for re-evaluation, but so far, the indices on workers' welfare and value are all pointing in negative territory. This program is open for partnership, sponsorship, and support. Reach us through our email and social media platforms. I believe it has been a swell package for you today. You can watch again on our social media platforms as we give credit to the International Labour Organization for some of the clips you saw in the program. Let's do this again. I am yours, Abulu Osemahu. Thanks for joining us.